quantifiable risk of having Ebola. So in other words, if you were in an area where you strictly adhered to personal protective equipment and had no obvious other exposure to bodily fluids of somebody with Ebola, we have a strategy that we plan called active monitoring, where we follow you up.
So New York City was caught off guard. Is that true? New York City was caught off guard. The governor put this in place for the state of New York.
Well, right now we are in fact waiting for guidelines from the governor directly about what exactly this means.
Okay, so will you be upholding this mandatory quarantine? And if so, how do you do that? What's the infrastructure in place? What's the procedure? Does it mean people have to be quarantined in their homes? Do you have a facility where these medical workers are, pinpointed as soon as they get off the plane, and then they go to a certain facility at a hospital or somewhere else?
Well, as you know, we actually currently have 3 people in quarantine right now. These are the contacts of the patient that was diagnosed on Thursday. So we have a very clear plan in place to make sure that somebody can be kept either in their home or, if necessary, in an alternative facility. Right now, all 3 people who are in quarantine in New York City are being kept in their homes. They get a daily visit, both by a medical officer from the health department to check on their health, as well as a visit by a welfare caseworker, somebody who can basically take care of anything that they need unrelated specifically to their health, whether it's food or books or entertainment. So we have planned to make sure that people who are kept in quarantine are ideally kept in their homes, and even more importantly, that their emotional and physical health is supported during that.
And how is this financed? Because we're talking about putting people in a position where they can't go to work. They can't earn a living. And how do they go on with that kind of financial support? Is that something that New York as a state or even as a city is supporting or supplementing?
Well, right now, as a city, the case managers that are working on this are from what's called our Human Resources Administration. They're the people who also manage programs like welfare. So they are very well prepared and, frankly, financed by our city to make sure that people get cash assistance if that's necessary. We've thought through this very strongly. Before we even started, before we began implementing this, we already had plans in place, and those included consultations with ethicists and others. We take it very seriously. Taking somebody and separating them from other people really has to be based on the highest possible evidence, and when you do that, the people there have to be treated extremely well.